Why doctors? Why do you think they could be instrumental for what you want to achieve in the House and in the Senate?
Well, actually, doctors across this land who are charged with caring for the patients in our nation are troubled by what they see going on in Washington right now. And they're so troubled that they want to get more involved. So we've reached out to them, and tens of thousands of them literally have contacted us and say they want to be involved. They're terribly concerned about the intervention of Washington into the practice of medicine. And that has led to many of them saying, boy, oh boy, would it help if I ran for Congress? And we're seeing that play out right now.
Representative Price, in no surprise that the president talked about giving a boost to small businesses. You have built a very successful orthopedic practice, 475 plus people employed, revenues of $50 million a year. People, I think, might be surprised to know that a physician could put together a small business that's frankly is lucrative. Is that the genesis for wanting to see these changes?
Well, certainly the physicians across this land know that most of them are small businesses, and they're being encumbered by not just the threats in the health care bill, but the national energy tax, the regulatory reform that we're seeing put on the floor this week in the House of Representatives will stifle the ability of small business across this land to be able to start businesses, create jobs, and do all the things that will, in fact, reinvigorate our economy. So what the physicians of this land are saying is no different than what the small business people across this land are saying, and that is, Washington, get out of the way. Don't encumber us. Don't keep us from being able to do what we know how to do, and that is create jobs. This administration has hurt the ability for small businesses to create jobs and continues to do so even today.
Craig, worst kept secret around that most doctors are in fact quite conservative, but interesting also that if you look at physicians in the recent polls, they support a public option and a streamlining of some kind of health care reform. Craig, do you think there would be a seismic shift in Congress if more doctors were recruited?
Well, of course, I'm all for more non-lawyers in Congress. I think that's a good thing. and I say that as a licensed attorney myself. But we do find that the doctors are generally more conservative. They are small businessmen, as you point out. And I think the Democrats would run against some of these candidates. I can see it already, as they are only in this for their own personal financial gain and not about expanding health insurance to others. Of course, the American Medical Association already out front today complaining about the expansion of Medicare in this recent Senate deal. I'm guessing Congressman Price will probably be able to recruit some more doctors once they find out about this Medicare expansion.
Congressman, go ahead. What are your thoughts about what's come out of the Senate from what you understand so far? How does it jive with what you guys were able to put together in the House?
Well, I think Craig's right. I think any expansion of Medicare, which has been a wonderful program for seniors, but is on a trajectory that can't pay for itself. It's literally trillions of dollars in unfunded liability to the nation.
But isn't that because you guys have not held the insurance industry's feet to the fire?
No, this is Medicare. This is completely different. This is the government program.
I understand that, but private insurance is part of Medicare.
Yeah, but it's just the third-party administrator. It's the third-party administrator, in fact, that it does what the government wants done. The fact of the matter is that an expansion of Medicare will only accelerate the difficulty that seniors and others across this land will see in having difficulty finding physicians. If you're a new Medicare patient right now, almost in any city in this land, you have a very difficult time finding a physician who will be able to see you as a new Medicare patient because of the rules put in place and the payment for the services.